Americans who test positive for COVID-19 may no longer be required to stay home and quarantine from others. The CDC is reportedly weighing dropping the 5-day isolation recommendation for COVID-positive patients. Experts and health officials told the Washington Post that the, quote, new reality, with most people having developed a level of immunity to the virus because of prior infection or vaccination, warrants a shift to a more practical approach. Per the Post, the CDC's new plans are to recommend people stay home as long as they've been fever-free for 24 hours and are experiencing mild and improving symptoms.
Meanwhile, new studies found that millions of people are reporting long COVID symptoms after their initial infection. One study on pregnant women found that 1 in 10 who were infected while carrying have experienced long COVID symptoms.
Mm-hmm. Those are really high numbers. I know that I had friends who were pregnant during COVID, and they were very worried about a lot of different things. They were worried about the implications of the vaccine. They were worried about what it would mean if they caught COVID while they were pregnant. They were worried when their babies were born about how vulnerable they would be. And obviously some of those concerns have been allayed, but there is just so much unknown about it. And to discover that 1 in 10 women who were pregnant and contracted COVID seem to be still dealing with symptoms is a disturbing figure. What do you make about, sorry, I didn't mean to interrupt.
Right, I mean, say they are suffering symptoms. I mean, the problem with long COVID is a lot of the ascribed symptoms have a somewhat vague aspect of the brain fog, fatigue, anxiety, etc., which I separate a little bit from the lasting respiratory complications, that kind of thing, which does happen in many cases and is more concrete. I've been skeptical in the past and continue to be skeptical, given that disproportionately people who are already in high anxiety groups or hypochondriacs are more likely to report suffering from what is a disease that defies explanation, brain fog, tiredness. So I have a lot of underlying skepticism of these.
So when doctors diagnose long COVID, are you saying that
diagnose you by saying, they just ask you?
No, that's not true. We haven't talked about this very much on this show, but outside of this show, where there's more of an audience for this sort of thing, there's a lot of research that's been done around the medical community. I'm talking about doctors reporting on brain scans of people who have had long COVID that are demonstrably different.
Okay, these aren't brain scans. What you just cited with pregnant people is them saying
I'm citing
symptoms.
I read the same read that you saw. Doctors diagnose women, 1 in 10 women who had contracted COVID during their pregnancy have long COVID.
By scanning their brains.
I don't know, but a doctor's diagnosis is not something that I'm going to throw out the window because it's politically inconvenient for me. What I will say is that's concerning, and there obviously should be more investigation into that. To that end, there was the first ever long COVID hearing that actually happened yesterday. We're now 4 years into this, and this is the first time that there's been apparently some congressional inquiry into what's going on here. We have a clip of that. Let's take a look.
Now, you should be asking me now, how do we prevent long COVID? Well, the best way to prevent long COVID is to prevent COVID in the first place. There is actually no long COVID without COVID. If you go back to 2019, you go back to 2018, none of us have heard of long COVID. Have you? You haven't. It didn't exist. There is no long COVID without COVID. We need a sustainable, multi-pronged approach to prevent repeated infections that would be embraced by the public. This requires accelerating the development of oral intranasal vaccines that block infections. This is very, very, very important. Ventilation and air filtration systems are also very important. They can play a major role in reducing the risk of transmission of airborne pathogens. We also need variant-proof vaccines. What the virus is doing is really continuing to mutate on us. Every few months, you're going to see a new variant. We need a variant-proof vaccine that lasts for a long time, that is durable, that offers durable immunity. People are sick and tired of having to have boosters every few months. We need vaccines that last for 5 years or so they can get it done and get it over with for 5 years. We must also understand vaccine side effects. This must be acknowledged and understood very, very deeply. This is very, very important. Now, you should be asking me also, how do we...
So I thought there was a lot of compelling in there, really recognizing that the vaccine side effect issue, which has gotten really short shrift, is an important one. That he's talking about another concern of the kind of vaccine skeptic community, which is that the vaccines weren't sterilizing vaccines, that weren't vaccines that actually prevented you from getting COVID in the first instance. So he's emphasizing that they've got to keep working to develop vaccines that do that the vaccines have to be more durable than they've been so far, so that they can protect you for 5 years or more, instead of being vaccines that, 1, don't prevent you from getting COVID, and 2, you have to go get boosters to get, and then 3, that rolls into the concerns about the side effects of vaccines. So all of these things are really related. And then talking about things that are much less invasive, like ensuring that there's good air quality and that people have access to other kinds of interventions that can prevent the spread of COVID. I follow an epidemiologist who really has opened my eyes to the extent to which a lot of more affluent people in particular, and folks that are in professions where there's a lot of high risk and money on the table if they get sick, athletes and the like, to use nasal sprays and the like that have shown a lot of promise in preventing people from contracting COVID. But again, those are resources that aren't broadly talked about anymore. Obviously, the Biden administration has said COVID is over. You have the CDC policy, which is shifting, not seemingly on the basis of any new information about whether or not COVID is contagious at that stage, but simply for, quote, practical concerns, saying that people should no longer quarantine, not saying that they should stop quarantining because they're no longer coughing or sneezing or sniffling or, wiping their mucus on things, but simply when they have no fever for 24 hours.
Well, it said improving symptoms. I don't think you should have to wait. I mean, the reality is they're not following this guide. People now have adapted to well, sure, but people have adapted to. Now, frankly, people don't stay home enough when they're sick. I agree. If you are sick and symptomatic, you should stay home. And if you have to go out in those circumstances, or you have to travel in those circumstances, like if you're coughing and sneezing, I think that's a perfectly good idea to wear a mask. If you're ill and you've recovered and you're no longer symptomatic, I don't. Just like any other illness, most people would not stay home from work an additional 3 days or quarantine themselves an additional 3 days if they were no longer sick with the flu, they got over it real quickly, or if they had some other respiratory issue and it had been like a 24-hour thing, they wouldn't just sit it. So why treat it differently at this point?
I agree that people don't, but I think that they should. I think that we should live in a society where, 1, people do mask when they're sick, like in many places in East Asia, there's an expectation that it's common courtesy not to come into public coughing and sniffling the way. Boy, oh boy, you walk into an airport around the holidays and it sounds like you're in a hospital ward, the way that people are hacking and coughing, knowing that they're about to be in tight quarters with a bunch of other people on the plane, and there's nary a mask to be seen. And 2, I wish, this is obviously my perspective as a leftist, that the reason that people are forced so often to go to work sick, to go to work 9 months pregnant, to go to work in all of these conditions that are not necessarily advisable from a medical perspective, is because we don't have sufficient paid sick leave, and there are so many people in this country that cannot afford to take a day off work, even if they technically get permission to do so. And so I do think this is a systemic social problem. We should not putting the burden on individuals who might not have the money and resources to stay home to be forced in that situation, which is why these guidelines can provide some kind of insulation for folks who are trying to advocate for their employer. Hey, I want to be able to take this time, but if even the CDC says get back to work, who's really being advantaged by that?
Forgive my skepticism on the whole idea that we'll develop. Look, I would love to develop. I was supportive of the vaccines initially because I wanted to be done with the pandemic. I hate wearing masks, and I wanted it to be the case that it was going to stop you from getting COVID entirely, working more like a vaccine for, measles or mumps or whatever. Instead, it works like a vaccine for the flu, in which, while it's an advisable thing particularly for at-risk people because it reduces your severity of symptoms and your risk of being hospitalized or suffering death, it does not. It might make you symptomatic for less long, so less likely to pass it on. Again, I've gotten vaccinated, I've gotten boosted. People should make this decision for themselves. It should never be forced on them. But it works like the flu vaccine, which we've had for a long time, and we've not managed to improve into a version that actually prevents you from getting the flu altogether. I think that would be great if they can do that, but he's talking about that. I don't know how realistic that's ever going to be, given we were not able to do that for related illnesses.
I don't think that's a fair and accurate analogy.
And what is this nasal spray that stops you from getting it? What are you talking about?
It's exactly what it sounds like. What's the confusion?
No, I've never heard of this.
Well, maybe we should do a segment or two about all the other kinds of COVID research and interventions that have been going on, instead of having a kind of a narrow political view on covering this particular issue. I'm trying to find the name of it. I think there's one that's called Innovid spray. It creates nitric oxide when the spray is released from the tip of the bottle. It's been formulated I don't know. I'm just reading stuff.
Does it stop you from getting COVID?
Yeah,
or
it blocks it in your nasal passage.
Like the
It's
thing
it's
they
a
take
killer.
in what is that? The second Knives Out movie. It takes place during the pandemic, and they spray him with something.
Yeah, it's sort of, I guess, but it's more like of a barrier than a neutralizing agent in your body or anything like that.
All right. Well, we'll do more research there.
Yeah, we'll get back to you on that. Stick with us. More Rising after this.